My name's Nina, I'm 29 and I've had the condition called dystonia. It's a neurological condition that causes involuntary muscle spasms. Every day is different and sometimes I can be absolutely fine and then within a couple of minutes I'm on the floor having quite intense muscle spasms and they affect my whole body so that it can get quite painful and it can get very tiring. They thought that the problems came from the lack of oxygen at birth. They did different tests and things on me when I was a baby. Nothing came back as obvious. I saw a local paediatrician. They thought it was cerebral palsy. I was very fortunate as a child that my OT physio and paediatrician, that they were absolutely fantastic. They always said that I never quite fitted in with the cerebral palsy diagnosis and they would treat the problem rather than the diagnosis title, and how much better my life was because of it. I was still being treated by them as a 19-year-old adult on the children's ward, and as they hadn't been happy for quite a few years with my cerebral palsy diagnosis, they decided then to send me to a neurologist at the Heath Hospital in Cardiff. So he then sent me to a neurologist who specialised in movement disorders. They then sent me to the dystonia specialist in Bristol. They confirmed that it was dystonia. There's no specialist within Wales, so the decision was then made at that point for my care go over to them. Speaking to them about dystonia, you don't have to explain it, but that doesn't mean your GP's seen it before. My GP was brilliant, and when I saw him and explained about dystonia, the basics of what it was, I was on all these different medications. So he said, look, I do not know what dystonia is, but you're the expert in you. You teach me, I'll learn along the way, I'll do some research and we'll get there together. And I know so many different people that have constant battles with medical professionals saying, no, you're wrong. And you lose all hope because you just think the doctors aren't listening to me, people don't believe my pain is this bad. So having a medical professional admitting that they're human, that they don't have all of the answers and that they're willing to help you, it's just so reassuring to know that you're being listened to. The main reason we started taking the photos was for the doctors to get more of an insight into my condition when I am having those bad days. They did say that seeing those photos, that they never would have thought that that was possible. For me being sat there and then seeing that worst case scenario, it just showed how bad things can get for people. And when you see them in the clinic and you speak to them, that doesn't mean that that's what they're like every single day. So sometimes I walk into an appointment, or sometimes I'm pushed in a wheelchair. Different levels of medical professionals. Sometimes they'll speak to me and sometimes they speak to my parents if I'm in the chair. They don't realise that they're doing it, but you're making a patient feel even more invalid in a way. I've had some doctors do it brilliantly and others who just make you feel quite worthless. Just because somebody's in a wheelchair doesn't mean that they can't speak to you. So going from the Hillside Health Board within Pembrokeshire to then the Swansea Health Board, I was also under the University Health Board in Cardiff, and they all use different computer systems. So quite often I've had the issue where I haven't had my letter from one clinic appointment when I've gone to see another medical professional. So I then have to repeat everything that happened during that appointment, what the doctor wanted to happen with my treatment plan, and occasionally I've forgotten things or questions have been asked and you go off on a tangent. And then going into England as well, with it being a different health board, again, when they try to speak to my neurologist or my GP within Wales, they type up a letter and it can take 6-9 months. So by the time my GP then receives it, a lot of what was in the letter is no longer relevant. And it can be quite hard constantly being your own advocate and going between all these different doctors, nurses, as well as all the different health boards, and continually having to explain yourself. Sometimes you get appointments come through for different health boards, when really you only need one appointment. They're kind of duplicating things as well. Just to make those pathways easier, it would just be brilliant if all of Wales had that same system that could be accessed by an A&E doctor, a GP, a neurologist, a physiotherapist. I know for a majority of patients that would be a relief and a weight off their shoulders. Having that weight lifted would be an amazing thing for a lot of patients.